EMDR therapy, how it works, and what the science says eye movement desensitization and reprocessing, EMDR, has emerged as a highly effective method for treating trauma. But understanding why it works requires looking at the underlying science. This article breaks down the process, examines the research, and clarifies what makes EMDR a viable option for those seeking recovery. The 8 phases of EMDR treatment. EMDR isn't just talking about your problems. It's a structured, 8-phase approach guided by a trained therapist. The initial phases focus on building trust and safety, a crucial step for any trauma work. Clients begin by identifying traumatic memories, then learn relaxation techniques to stay grounded during intense reprocessing. The core of EMDR involves bringing up distressing memories while simultaneously engaging in bilateral stimulation, typically side-to-side eye movements, but sometimes auditory tones or tactile taps. The purpose: to activate both hemispheres of the brain, allowing for more efficient emotional processing. How EMDR reprocesses trauma. The brain doesn't always store traumatic memories like regular events. These memories often get stuck in the amygdala, the brain's emotional center, causing persistent distress. EMDR seems to recalibrate how the brain processes these memories, shifting them from a raw, emotionally charged state to a more adaptive one. One theory suggests that the dual attention task, remembering trauma while moving your eyes, disrupts the amygdala's grip on the memory, allowing the prefrontal cortex, the thinking part of the brain, to step in and integrate it more healthily. This isn't about forgetting, it's about reducing the emotional intensity. The evidence: what studies show? Numerous studies confirm EMDR's effectiveness. Randomized controlled trials consistently demonstrate that EMDR significantly reduces symptoms of PTSD, anxiety, and depression. Some research indicates that EMDR can achieve comparable results to cognitive behavioral therapy, CBT, but often in fewer sessions. The success rate is high. Roughly 70–80% of clients report substantial improvement in post-traumatic stress symptoms. Importantly, these gains tend to last, suggesting that EMDR doesn't just mask symptoms, it fosters lasting change. EMDR versus traditional talk therapy. While both EMDR and talk therapy, like CBT, help process trauma, they differ in approach. Talk therapy often involves deep exploration and reframing of thoughts and behaviors. EMDR, in contrast, prioritizes experiential reprocessing through bilateral stimulation. This difference is significant. EMDR doesn't require clients to verbally dissect every detail of their trauma. The stimulation helps the brain do some of the work on its own. This can be especially valuable for individuals who struggle with verbalizing traumatic experiences. Who is EMDR for? EMDR isn't a one-size-fits-all solution. It works best for individuals who have experienced specific, identifiable traumatic events. However, a thorough assessment is essential. People with severe dissociative disorders or unstable mental health conditions may not be suitable candidates. A strong therapeutic relationship is also critical. Trust and open communication between client and therapist are paramount for success. Final thoughts: EMDR provides a scientifically supported, structured approach to trauma recovery. By combining guided exposure with bilateral stimulation, it helps the brain reprocess distressing memories and reduce emotional suffering. While not a quick fix and not appropriate for everyone, EMDR offers a hopeful path toward lasting healing for many individuals burdened by trauma.